Hey everyone, today we're going to put on our detective hats for a pretty fascinating medical investigation. We're on the hunt for a suspect that's a master of disguise, hiding behind some very common symptoms.
So, picture this. A patient walks in with a fever and a painfully swollen joint. Now, it could be a lot of things, right? But one possible diagnosis on that list could change their life forever, and that's where our investigation kicks off.
Our case file opens with what seems like a pretty standard diagnostic puzzle: a patient with a fever and a swollen knee. The symptoms look straightforward enough, but one of the prime suspects is rheumatic fever. The big question is it the right one? Okay, so with any good mystery, you've got to know your suspect, right? Before we can even look at the evidence from our patient, we need to build a really clear, accurate profile of rheumatic fever itself. So, what is rheumatic fever really? Well, at its core, it's an inflammatory disease. But here's the twist: it's not the infection itself. It's the body's own immune system kind of overreacting to a previous strep infection that wasn't fully dealt with. It's basically a case of friendly fire inside your own body.
And this is our main culprit. The specific bacterium that kicks off this whole chain reaction is Streptococcus pyogenes. You've probably heard of it. It's the same bug that causes strep throat. This tiny little microbe is the initial spark that can lead to that massive inflammation of rheumatic fever.
You know, every suspect has a pattern, a kind of MO or a modus operandi. So let's follow the clues and take a look at the classic signs, the calling cards, if you will, that rheumatic fever almost always leaves behind. So, first up, the joints. Rheumatic fever is super picky about where it strikes. It almost always goes after the big ones. We're talking knees and ankles. It very rarely messes with the small joints in your fingers and wrists. For a doctor trying to solve this puzzle, that kind of specificity is a huge clue. And then there's the heart, another major target. And again, the attack is incredibly specific. The disease mainly targets the endocardium, that's the delicate inner lining of the heart, while it usually leaves the myocardium, the powerful heart muscle itself, alone. How it attacks is also a huge clue. It causes acute arthritis, a really sudden, intense inflammation. But what's crucial here is that, unlike other conditions, it doesn't typically cause chronic damage that can lead to something like osteoarthritis. It hits hard and fast, but it doesn't stick around to destroy the joint. Okay, so beyond the joints and the heart, there are these other telltale signs. And one of the most distinctive is a condition called chorea. We're talking about involuntary, jerky movements that can almost look like an uncontrolled dance. When a doctor sees this, rheumatic fever just shoots to the top of the suspect list. All right, so we've built our suspect profile. We know its habits, its calling cards. Now it's time to actually crack the case. Let's take everything we've just learned and match it against the real evidence from our patient's case file. Okay, let's pop open this case file and see what we've got. Rheumatic fever pretty much always follows a recent strep infection, but our patient didn't have one. Autoantibodies were negative, another piece of the puzzle. But here's the real kicker, the thing that breaks the case wide open. The patient had high ferritin levels. That is not a primary marker for rheumatic fever. The evidence just isn't lining up. And just like that, with all this conflicting evidence, especially that missing infection and those high ferritin levels, the investigators reached their verdict. As the file says, the diagnosis was ruled out in favor of Still's disease. Our prime suspect, in this case, was innocent. And this really gets to the heart of it, doesn't it? The big takeaway here is that not every fever with a swollen joint is rheumatic fever. So many conditions can look similar at first glance, and a really thorough investigation, looking at all the evidence, is absolutely essential to get to the right answer. Now, our patient didn't have it, but this whole investigation really shows why getting that diagnosis right is so critical. Because if it is rheumatic fever, there's a very specific protocol you have to follow. So let's look at what the right response is for a confirmed case. So the treatment is this really clear two-step attack. Step 1 is all about eliminating the source. You give benzyl penicillin to wipe out any of that lingering streptococcus bacteria. Then, step 2 is damage control. You use steroids to get that intense inflammatory overreaction under control and prevent any further damage.
And listen, this is absolutely critical. While IV ceftriaxone is a heavy-hitting antibiotic used for all sorts of serious infections, it is not the standard treatment here. Using the wrong tool for the job can be completely ineffective and just delay the proper care. It's a perfect reminder that in medicine, Just like in an investigation, precision is everything.
So think about what we just saw. The body's own defense system can get tricked by a common bacteria into launching this huge attack on itself, creating a mystery that's incredibly hard to solve. It really makes you wonder, doesn't it? If a simple sore throat can kick off a disease this complex and dangerous, what other incredible secrets is the human body still hiding from us?